going to present a case. The case was with subluxated IOL and CTR, and was presented with total.
Sugnesh, please make it a slideshow, please. You have not started your slideshow.
Yeah, sure. Yeah. So, presenting the case, it was managed in a different way, little bit in a different way. This was a case of subluxated IOL and CTR with total retinal detachment, and no any direct financial interest in any product mentioned. The case history was like 50 years old female presented with sudden loss of vision in her right eye, and patient was operated for right eye cataract surgery with CTR incision and IOL 3 months back. On examination, there was subluxated capsular bag with subluxated CTR and IOL along with total retinal detachment. So this was the anterior segment photo showing subluxated IOL and subluxated bag, and this is the fundus picture on right side showing total retinal detachment. So the patient was operated with 25 gauge vitrectomy surgery. The subluxated CTR with IOL were removed to SICS incision. PHCL injection was done, endodiathermy done to the break, and endo laser done. The posterior iris flow IOL implantation was done. As I was having the IOL power available with me because the patient was operated 3 months back only, and there was no any support for IOL, so I opted for posterior iris flow lens. Then PHCL was exchanged with air, and air was exchanged with silicone oil. This is the first post-op day. You can see the IOL is well in place. The iris was a bit dilated because of some trauma during the previous cataract surgery. The retina seems on in silicone oil field eye. This is exactly after a month of surgery. Again, IOL well in place. Retina is well settled. OCT is almost normal, and vision was 624. With the best corrected visual acuity was 6/24. This is 3 months post-op. Best corrected visual acuity was 6/12 Retina is well settled. OCT is showing a normal foveal contour, and IOL well in place, except a bit that the pupil is dilated. That's it. So to conclude, IOL implantation can be done simultaneously along with RD vitrectomy surgery with good anatomical and visual outcome. Thank you.
Very nice presentation, Dr. Sugnesh. So do you routinely do this IOL implantation?
No, ma'am, not routinely, because most of the time we are not having the IOL power calculated with us in patients with total retinal detachment. But luckily in this patient it was available, so I did it. I did it with RD vitrectomy surgery.
So did you have any like the globe was soft or any intraoperative difficulties?
Pardon, ma'am?
Did you have any intraoperative difficulties while putting in the IOL?
No, ma'am. What I did during the surgery, this patient was actually from the civil hospital, Bhavnagar, and I operated the patient at there only, and there was no recording system available. So what I did after doing vitrectomy, I just put the PHCL inside. I did the endodiathermy and laser, and then I put the IOL. So during that period of time, the retina was quite well settled, and the things were quite easy for me to insert the IOL and tuck it with the posterior surface of the iris. And then I did the PHCL air exchange and then air silicone exchange. I had to take care of, because there was no support, there was no capsular support, so I had to take care that the silicone oil could not come into the anterior chamber.
But when you did a PFCL air exchange, the IOL was stable.
Yes, well stable. Yes, ma'am.
Supriya, we'll have to move a little fast because we are really running short of time. We have to wind up by the next session would come in. So
Sure.
Sugnesh, very well presented. Would love to ask you more questions, but I think we'll have to move on to, I was very keen to know, did you do the IOL and the CTR explantation together or did you do it individually?
No, I did it together. It was quite
Encapsulated.
Subluxated bag. It was
Okay.
entirely stuck. So
Yeah.
they came entirely.
Yeah.
in a single-
But sometimes it is very difficult because sometimes when you're lifting that bag complex, you may just realize that the CTR slips away and then you just have the IOL in your hand, and then it's extremely difficult to go and pick up only a CTR from the retina. So that's your challenging point in such a surgery. I mean,
I had one video available with me, which I did. There was dislocated IOL, dislocated CTR, AC IOL, and total retinal detachment.
oh,
Yeah.
wow.
I had to remove the NTA chamber IOL first, then I did remove the IOL CTR, and then I did the vitrectomy surgery for retinal detachment.
A very determined cataract surgeon has in an IOL.
Usually,
But
this,
CTR
usually,
is a surprise when you go in, you don't even expect a CTR. You just think it's a, and then you find the
Yeah.
CTR. Yeah.
Even I thought
the size of this IOL is very small.
unfortunately,
Yes.
The iris flow problem is the size of IOL is very small.
True.
When in oil-filled eye, sometimes the oil comes up and you are lucky that.
for that, I did take care that the oil should not come out, and for that, I injected some visco into the NTA chamber so that it will not allow the silicone oil to come anteriorly.
Okay.
Sure.
Thank you, Dr. Sugnesh. Yes.